A very warm welcome from Birthright by Rainbow Fertility Center. I am Dr. Ratna Durvasula and I have some super women with me whom I am going to shortly introduce. So the purpose of this conception conclave is that 25th July, the first IVF baby, Louis Brown, was born, and since then we've had millions of babies, and we are trying to create awareness and celebrate this week as a Fertility Awareness Week. So, just a few words about Rainbow Fertility. We started off as a 3-member team, and now we are 20 plus doctors with IVF centers across the whole city. We have them in the nerve center is in Kondapur, and we also have them now in Banjara, Hydernagar and LB Nagar. So, we have hope to carry the name forward that Rainbow and Birthright are associated with world-class treatments. And we also have empathetic doctors and a place that feels like home when you come for treatment. So now the purpose of this conclave is in this confusing time where world are expecting women to be super women, managing careers, managing homes and doing a great job everywhere. They carry multiple roles of being daughters, daughters-in-law, wives, mothers, career women, CEOs. I have with me a panel of 5 ladies who are super women in their own fields. Briefly introduce each one of them. So on the first we have Mrs. Astha Gupta. I am going to introduce her very briefly, but she is a real superwoman. She is working in the Barclays as Assistant Vice President. She is IIM and an MBA from an IIM. Across 15 years, she has been catering to various MNCs, and she is also a very proud mother of 4-year-old twins. Thank you for coming, Astha.
Thank you so much for calling. Thank you. Thank you. Thank you.
Then I have Ms. Gauthami Kanuri. 2-3 words are not enough, but anyway, she is a great person. I have known her for the last so many years as a good friend. She heads marketing and is a lead for the lead technology startup Darwin Box, which I think is a unicorn. She's a computer science graduate and again an MBA from IIM Lucknow. Thank you so much, Gauthami. Thank you. And now I have another superwoman, Dr. Anupama. She is a bit of both of us, that is a bit of medicine and a bit of corporate superwoman. So, right now she is with Seneca Global. She is also an IIM graduate, and she is also doing a lot of social work, and she is most importantly training the youngsters in being entrepreneurs. So thank you so much, Anupama, for coming and spending your time with us.
Thank you.
Yeah, and you should not always forget to introduce your own family. I have on my left Dr. Preethi Reddy, well-known figure and our lead IVF consultant, mother of 2, and well, I should not say too much, but she leads our fertility department in Rainbow Fertility. And our young and upcoming consultant, Dr. Pallavi Chalasani, she is in Hydernagar Rainbow and she heads the fertility there. So, with all these, the purpose of all this is actually a takeaway message to all the young ladies over there who are trying to build up their families and their careers in this world of confusion. We had COVID, we had post-COVID, now we have recessions, we have layoffs, we have so many things going on in the planet. So these 5 beautiful ladies will help us to get some messages and how to go about life. So I'll start off from the right side. Each of you can just give me your take on the questions that I asked. Yeah. So was preconception care a part of your thoughts in your mind when you were planning your family?
So actually I got married really early, and this biological clock was always there in my mind, and my mother was the driving force behind that. So as a control check, every year I used to consult my gynac, and before even trying for the baby, I went through this preconception care which I have to go through, and I prepared my body in terms of diet, in terms of food and exercise and lifestyle changes, which I already started, which really helped me throughout my pregnancy to maintain the weight. And as soon as my delivery was done, I reached my normal weight really quick. So that really helped me in all these planning things.
That's great. So you were self-aware. You didn't neglect yourself at all.
Yes.
Thank you.
Yeah, I think in general, having a healthy lifestyle and giving a lot of thought to what you eat and how you live your everyday has always been a good emphasis in my life, especially because, okay, I had an idea of when I wanted to plan my pregnancy and everything. It was important to stay healthy all the while, not just about the period before. I definitely wish and I would advise everyone to like take a gynaec's consulting like much earlier. That is one thing, if I go back, I would have done sooner, right? But it was very helpful once I consulted and once I got to understand what is required in that phase. A few minor modifications to the lifestyle that I've already planned for. So yeah, one is like definitely do think of just meeting a gynaec before you're thinking about conceiving. Because we somehow think we know everything, but there is still more that, you know, that you can educate yourself with, like especially today, because we feel that, okay, we're well to do in terms of education, careers, everything. We think that we are aware of these things, but there are still things that we are not able to talk about, that I think you will start thinking on those direction only once you meet your gynaec. So in pre-conceiving phase, definitely I would say that's one thing I wish I did sooner. I did it after a friend has actually advised me, right?
Just one thing to add, I think being free from disease is not being healthy. So we generally tend to think that if you're suffering from some problem or a symptom, then you know we're not healthy. But being healthy has got a much more definition to it.
Right. I think I fall into the vast majority category. I have not been so focused per se when it comes to preconception care, because I was an average, very ambitious lady just starting on her career and trying to build on the various dreams that we have at that point in time. Motherhood came as a very sweet surprise to me, and definitely it was positive and I took it forward, but the moment the surprise came is when I think a new mother is also born. So for a majority of us, sometimes preparation is a transformation. We start to think about ourselves and the upcoming journey in a new light once the revelation hits us. That's what happened with me. And the good thing is I had a very trusted friend who was an established gynecologist to whom I could go and I could ask all kinds of questions, share my dilemmas and my various thought processes and seek the right kind of support. I think even if we are the vast majority and totally unprepared and then we have these sweet surprises, it is important for us to take a moment, pause there and not just get with the flow from there onwards at least. And then while it is great to have a plan and be prepared, it is important to not neglect those milestones also. And then at least from where you are, you take the necessary care. Better late than never, like she said.
I liked when you said sweet surprise. It has to be a sweet surprise. Now, there's so much of micro planning or programming goes into a pregnancy. So, you know, once you see that there is a positive pregnancy, it's like, oh, I've achieved my target. It's not that kind of a, you know, attitude you should have when you're planning for pregnancy. It has to be very spontaneous kind of, you know, event happening in your life. So, absolutely, it has to be a sweet surprise.
Dr. Pallavi, your advice medically about preconception?
Probably prior we never had this preconceptional things before the era we were. So nowadays I think this is very, very important because of, you know, the lifestyle changes, the stress, and women more concentrating on the careers and the pollution, the adulterated food we are eating. I think all of this plays a lot of role that preconceptional care is really, really important in our lives. So it's not bad that you take a pill as soon as your engagement. I would definitely call folic acid pill as an engagement pill. So, you know, you get better, you know, outcomes with your healthy baby, and even if you have sweet surprises, you could enjoy a healthier babies.
Yeah, and I feel preconception care shouldn't start off just before you start planning pregnancy. I think parenthood is eventually sooner or later is going to be a part of your life, a phase of your life which you're going to come across. So I think immediately, you know, even you may think of planning your pregnancy 2 or 3 years later, but having an awareness as to, when is the time you have to start planning, that kind of an awareness you should actually, seek. Because I'm sure, as you mentioned, the biological clock, that is something which all the women should be aware of.
Yeah. So, sum up the message from all this is, just as you plan your whole life, they like to go to Sri Chaitanya, IIT, IIM, whatever, do have a plan when you are going to become a parent also. And just as you've gone to a coaching center, please visit any of your trusted lady doctors and get the correct advice as to when to plan and how to plan.
Yeah. There should be planning but not programming.
Yeah, absolutely. Planning doesn't mean getting stressed. I take your point. Yeah. Okay. Thank you very much for that. Now we'll go on to the more trickier question. How did you manage to strike a balance between work, life and taking care of your health in pregnancy, pre-pregnancy, post-delivery and all? Astha, would you like to start?
Yeah, so first thing first, I feel that discipline is the first factor, because I am the person who is not at all disciplined, but that really helped me. And I used to clock my food time. I used to put alarm in my phone. So that's how I planned the whole journey. And the second thing is, how you balance your work life is you have to create a very, very good support system at your place, be with your maids, be with your spouse or your parents or your in-laws. So you have to build that support system around you, because you cannot have everything. So you have to strike a balance kind of, and you have to prioritize what is important at that point of time. And so that's how I managed that. I try to build a support system so that nothing is being suffered. I can understand you cannot be at peak of your career and be a mother together, but there can be a little balance on that, so that life is more comfortable and it is easier to follow your life path.
So as a mother of twins and the only mother of twins over here, you have to take Astha's thing in, building a support system well in advance of your planning. Whether it's micro planning or whatever it is, very important so that you don't get stressed later on.
Yes, yeah.
Thank you, Astha. Gauthami?
Firstly, I think there's nothing called superwomen, so you can't do everything except that first. So you definitely need to make a choice on where is it that you want to spend your time and where is it that you want to take support of someone else. There, I don't know, like right now my kid is about 9 months old and I'm back to work however soon I could make it to work. So there is time that I want to take out to play with him, spend time with him and bond with him, but there are few things that I'm okay to give up and say this will be taken care by my parents or this will be taken care by household help who is there. So it's absolutely important to prioritize. Human body has limitation to how much it can cater to. So it's not like I'll suddenly become this extra powerful woman who knows how to handle everything is not an answer. So choose to whatever financially also buffer for that kind of support system that you need to build, right? It's important to have that. It might be a household help or a nanny, or it might be a driver who will drive you around when to work, so that stress is off your mind. So whatever areas you can take away the stress on your plate, you should definitely invest in that. Family support system is like the best, and if you have that, you're blessed. Please use that. Don't overcomplicate that family support system. Don't get into intricacies. It's always good if the kid grows with multiple people, is my belief. But most importantly, prioritize, right? You can't do everything. So it's about where you want to spend your time so that you feel good about it. And also please take away the guilt of not doing the other things. Very important. You're not expected to do everything. Right?
So thank you very much. So Gauthami has just told that we cannot be like Durga Devi and have 8 or 9 hands and do everything. Be okay with not doing things. Be okay with taking help. And yes, maintain peace and calm and take help. We are all in India. So there's lots of domestic help available. And yes, in-laws, parents, everyone will be happy to pitch in. There should be no egos over here. That's all. Yes, Madam Anupama.
Yeah. Definitely, I have 2 points here. The first is the support of family and ecosystem can never be stated enough. It is all the more needed today than any time else. And like our ancestors rightly said, it takes a village to raise a child. And it is not easy to instill every single thing like we grew up with, the value system and the education focus in this kind of a space, competitive space today as single working woman when you are working multiple things. And also when you are parents working together, then you are essentially not still available. So there's a lot of awareness, introspection, I think that's needed to be a parent and take that responsibility forward. That said, I would move to my next point where I think it's more about being conscious about the decisions, about the choices you make at each point in time. At the time when I should be kind of looking at ecosystem and everything, all through my 9 months of pregnancy, I was traveling 35 kilometers one way. So it was 2 hours journey one way and 2 hours journey the other way, and working 10 hours a day. But what is very important is throughout your space of your 24 hours, how much are you conscious about the care you take for yourself and for your health and for your baby and for your family? And what is the balance that you're striking towards your profession and your personal space at that point in time? Like she again rightly said, we have 100 things to do today and we cannot achieve 10 on 10 on each of these 100 things. But there are these calculated, intelligent pauses that we must take and say that, okay, this is not my priority at this point in time, and that is perfectly fine. I am not a A-rater today, but that is perfectly fine. I will have my day. And as we just thought, it comes from a lot of self-consciousness and that self-esteem, that belief system. And that will, I think, in turn come from the support system that we have built. And we cannot build the support system at work and at home when we are planning our family way. It has to be right from beginning. So there's a whole mindset shift that we see, that I want to be able to do everything right from our teens when we are in the overdose of our energy. We have to have this taking people along as a quality, both personally and professionally. Until we take people with us along in our dreams, aspirations and journey, this is going to be an everyday effort.
Yeah, we succeed as we rather than I.
Yes.
So it should always be a we.
I mean, just resonating on the same. So I think it's important to have a balance. I mean, fortunately in India, we have got a lot of support, family support. So that aspect of, child care and all that is taken care of. But there may be certain aspects which you may miss as a mother. But I think that kind of, a trade-off or a balance is quite okay. I mean, you being there for the child whenever, important aspects and important issues, you're there. But the other important aspect I would like to highlight is at the career. So you shouldn't take that taking a maternal break or planning pregnancy break as something which is going to stagnate your career. It's fine, absolutely fine. At that point of time, if you have to prioritize family planning and your family, that's fine. You just continue to work, and there at time, maybe after a couple of years or so, you still can go up in the ranks. So it's not always a comparison, like, we have started off together and now where am I in my career, and I have my colleague who's risen up in the career. So that's not more of comparison. So don't go by that kind of a stress. You need to do what is important for you. So you need to prioritize for yourself. You're not there to answer for somebody. You need to answer yourself. If you feel at that point of time, taking care of the child is very important, then absolutely accept it. That's absolutely perfect. So that's my way of looking at things.
Right, ma'am.
Anything medically about how to balance work and stress?
I think the extra point which I wanted to say is, it is very important, not only the family support, the support including in your office is also very, very important. So I think you should always have a nice team wherein, they also are going to be mother or they were mother prior. So the support system with one other, this lady support is very, very important in the ecosystem which has to follow. So it is very important that you should not always think that you're going to stop the career at one point and we're going to start it back at square one. It is never like that. It's just a break for 6 to 7 months wherein you can take a break and then start off again from the same point. It's not that you're going to start back or your juniors are going to come back to that same point and take off. you should not have that stress feeling.
Yeah, I think to add on to one more point, which I did during my time, I was working with UBS and I openly went to my manager, and he was a male manager. I was little skeptical to speak so openly, but still I went and spoke to him and told that I'm trying to conceive and I'm facing some problems, and so can the work be little balanced or something like that. And he was really happy to help me, and those 9 months he made sure that I was really comfortable. I worked till 8.5 months of my pregnancy, and 2 weeks only I took leave, and then my child was born. So I mean, that is also really important, that not only at home, we should also try to speak and get a support system from the office also, because they're all humans and they also understand.
To add on to this point, I think more than family or family time which we spend in 24-hour clock, we spend more time in the office.
More time in the office. It's like a second home. So.
Yeah, actually, a lot of the organization have women as their workforce. But then
Males as bosses.
So do you think it's different when, the males are there making decisions, or, or females making a decision? Do you have a comfort zone when you have a female or a...
It's all in the, I think, mindset, because it was there in my mindset that how can I go and talk to like this to him. But then I thought, let me give it a try, because we used to speak really well on general conversations. So I was like, let me speak, what will happen? He'll say no. But if he says yes, my life will be really easy, and that really helped me.
I think we should start, developing that kind of an environment in most of the organizations.
Yeah. So to conclude this point, there's just one thing that I want to add. Now, there's a lot of awareness about mental health, and there's a lot of therapy available in the form of psychologists. I think even all the major corporates have a psychologist in place. So don't be, if you're feeling low, if you're feeling confused and you really can't share certain things with a friend or a family member, you can really go for a counseling session. So I'll just say what my experience. So I relocated with a 2-year-old child to UK for higher studies and higher fertility training. So at one point of time, I was feeling really lost. My child didn't adjust to the daycare sessions in UK, and I was my husband was very busy, and I was the only point giving care. So at that time, there was a friend and a counselor in that local hospital. She said, this too shall pass. This is just a difficult time and this will pass. That single session which I had with her, over a cup of tea, it gave me a lot of strength to move forward. So there are certain points of time when we feel totally lost. So taking the help of a counselor or anybody in your office or anybody who is, gives you some psychological boost, that's also a very good thing nowadays, and there are therapists all over the place. If you just Google therapist near my place, you'll find somebody, and you definitely, it's a good thing to take help from therapists. They are not psychiatrists, but they'll just give you mental strength and a different perspective to the problems that you're going through.
Yeah. Just if I can add one thing about what ma'am was saying a while ago, just speaking about conceiving at your workplace is absolutely okay. And even if it's a male boss also, you'll be very surprised to know, okay, pregnancy like menstruation is not just a women only thing. Yes. Pregnancy is
not
both,
a taboo topic,
both men and women, right? So your boss also is, a husband whose wife has already bothered him enough about pregnancy, right? So he's very well aware, and surprisingly, I could have a very comfortable conversation, and in fact, we could discuss the details or what the trouble was, and hence like, hey, it's taking a little longer or whatever it is. Empathy was absolutely there, because he understood where they were as well in their own journey. They were also aware.
I think there should not be any hesitancy from our side to approach.
Yeah. And I think this is not an exception that we are talking about having good male bosses. This is the norm. And it is mostly the hesitation that we have because we haven't had that kind of conversations quite often in our spaces that we approach people and talk about it. There is one platform that I'm associated with, which is IWN, where one of the things that we constantly tell women is have these conversations. While they may seem very difficult to you when you are starting that for the first time, they're pretty much okay and normal, and people have been speaking about things all the while. So it's very important to kind of call your friend, call the person, colleague at your workplace or your manager, and just ask, asking is just what matters.
So I think we should thank society for removing the taboo surrounding menstruation, pregnancy, and giving us empathetic bosses. So thank you to all the men bosses over there who have been empathetic to their lady colleagues. Thank you very much. So,
But though pregnancy is a natural process, it still needs that special care.
it sure does, yeah.
Just an add-on, I went to a corporate talk to some company, and then when I started asking people that would you be able to approach your boss or tell that you're pregnant or you're trying for pregnancy, you need to come for consultations so many times, they all said no. That mental taboo, I think it is not in the society, it is within us also, that we have to come overgrow that and just go ask. Probably they might help you. They would have also gone through the same situation. I think that we also should overgrow.
Yes, sure. Absolutely.
Okay, so now this is another common thing that everyone is facing. Was stress a problem when you were planning your parenthood, and in what way did you overcome it?
Yes, stress was really a big problem because I was trying for 2-3 years and I consulted so many doctors, and at a point I literally gave up. And then my husband was like, what I can do for you to make your life easy? I was like, okay, I don't know when the child will come, but at least I need something which makes me happy, and that would be a pet dog or something. And the moment he came in my life, it was altogether a different story because I relate to pets a lot. So he released my stress like anything. My BP was normal because I used to go for a walk. I played with him. So that really helped me out. And he came in Feb and I conceived in August. So, I mean, that's how you can manage your stress. You have to find what is your stress buster.
Absolutely.
So that was mine.
I think there's obviously going to be stress, so don't shy away from that. There are different things that work for different people, but the stress, let's say, pre-conceiving is about the anxiety that is there, whether this will happen or not. I think for me, what worked is to be busy, right? Just move on from that topic, fine, and then you get busy and you have a lot of work to handle anyway, so get back to that because there's nothing else that you can do. It's about telling your mind that, fine, better luck next time, right? And but during pregnancy, I mean, maybe or while conceiving, whatever anxiety, and I remember I did even give a call to Dr. Ratna saying, I'm not able to sleep since the last 3 days, I'm having sleep issues or whatever. She said, is your office like back to working from office? Then can you please go back to office and work and be with people, be, surrounded by a different kind of energy. So that's one thing. So distract yourself, don't keep yourself in that zone all the time thinking what will happen. But a very tactical suggestion, do take some kind of yoga, meditation or physical exercise, anything that can keep your mind calm and keep it happy. Right?
So I think one is the stress and anxiety with all the uncertainty within ourselves. But I think we also need to look at the stress factors in our life in general at that point in time, because it's a very, very important phase for the person. So for the family. So there are a lot of people who go muted through the entire journey, not addressing their work-life balance in the office, not being able to talk to their bosses, not being able to say no to the amount of work that they're usually doing, which could be their stresses. Sometimes if it's an internal anxiety, internal stress, talking about it, having deviation, what works for them is one definite thing. But a lot of times if you are a working person, then there are stress factors in your ecosystem, and the expectations that you will have to still meet irrespective of the process that you are going through internally. So setting expectations, setting boundaries, talking about your newer self is also something very important, because we tend to place a lot of emphasis on others' comfort at home and our delivery and our outlook in the workspace. We tend to not set these boundaries, and we tend to think that we have to still perform at a certain level, both in the workplace and at office. We don't probably realize that this is a stress that could impact us in the long term. So this is something that we need to be really conscious of and talk about and address.
Yeah, what I feel is the stress about embarking the journey of parenthood itself is a bit of intimidating. I think, women usually think, am I mature enough to start this journey? Is it the right time? What about my career? They set so many expectations around the whole thing. But what I feel is motherhood is something which is a natural trait which is in women. So that comes naturally once you get pregnant, biologically. You don't have to be prepared mentally that, what am I going to do once I get pregnant? Will I be able to handle? I think that questions will not arise. Sometimes, when women just get pregnant spontaneously and everything falls into place. All this stress starts off only when you start having expectations. So, trying to set some deadlines, trying to have a lot of these meeting expectations of family and all that. So, that is something which we should avoid. Let the pregnancy come in naturally, spontaneously, and that whole thing about, taking care of that phase, I think that comes very naturally to us.
Just to add on to Dr. Preethi, because what she said that triggered this thought process. I think there's very simple living in the moment that we all used to do all the while, that somehow we are so disjunct from being in this moment, enjoying this, what I am transforming into, and we are so after certain things, like she rightly said, certain expectations, that mere living in the present, enjoying this phase will put us back in the flow many a times.
Yes. So medically, probably I would like to add on, stress doesn't go off with a pill. So sometimes the doctors might be busy with their patients, they just talk about the treatments, tell you, okay, what next, and then they send off. But I think from the patient side or from the couple side, if they really want to talk to the doctor, it's not wrong that open the door again, I wanted to talk to you, for a longer while, I need some counseling, I have some stress, could I talk to you? I think that asking should come from the patient, wherein we are very, very happy to talk to the patient and counsel them for whatever stress they have and relieve it. Some people might have a stress burst, they're talking to a friend, or some might have with a doctor or with a nurse who they take an injection shot every day. So I think it's not really a bad notion to ask the doctor, okay, can you spend few more minutes or few more couple of time counseling. I think it should just come from the patient, and we are really ready to do that.
To add on to ma'am, actually during my pregnancy, the whole month, every month we'll be having a scan. So we made a WhatsApp group, me and my husband was there in that. So every single day, if we feel any questions that needs to be asked from the doctor, so we used to write in that. And once ma'am is done with her analysis, we'll say, we need your 5 minutes. And then we'll go through all the questions. And she was so sweet to answer so many questions. But it really helped us to release that stress. And next month when we come, even if we have that doubt, we know, okay, ma'am is there, right? I mean, she'll answer that question. And so that approach should also be there so that you clear all your doubts. And this will help to release that stress of worrying and then adding to more stress.
Just want to add something over there. It's absolutely important to have a very good friendly relationship with your gynac, and I really enjoyed my journey of conceiving over here. We could sit down even in like the bad times. We could sit down, we could crack a joke about what's not going right. It's okay, relieve the stress. And in probably very serious times, I think ma'am's confidence was something that relieved the stress as well. Like your confidence, all of you, when you were going through the situation and you were saying that, hey, it's okay, you can be calm. And I think the result will be positive if you are calm and if you are, in a good place. And it turned out to be that way. So your caretaker's confidence, your caretaker's empathy is something that will make a lot of difference. And I'll really, really want to appreciate how, despite a very busy schedule, all of you have been like super, super empathetic to what was happening. And one day there was one line that ma'am said, which was, casually, this was pre-conceiving phase and we were having a conversation, and she said, see, the excitement and the disappointment of conceiving or not conceiving is actually shared by your caretaker as well. Like on every day, they are seeing a lot more cases of, probably women being disappointed, and that mood and that energy is also something that they also absorb in some form. And they really try their best to bring back the positive energy and to keep us hopeful. So for that, really, thank you.
Thank you. So just to sum up, yes, stress is a universal problem. I always say this, from the little 2-year-old who's anxious to get into a bus and go on time to his DPS or whatever, and from us to juggling, and from men to maintaining their deadlines and all, stress is universal. Let's accept that. So what each of us should have is a stress busting technique which is unique, which works for us. So it could be a pet, as Astha said, it could be music for somebody. But now what I want to say is physical activity has gone on to a backseat for many of us. Even we are sitting just like you in front of computers and talking, taking lifts and, sitting in cars. So what I want you to do is, physical activity releases what are called endorphins in the brain, and these endorphins will neutralize all your negative cortisol related, stress related negative things. So try to be physically active in some way or the other. So when we said go do 8,000 steps, one patient promptly said, "Doctor, I got backache, I got foot pain." So yeah, I don't mean just take 8,000 steps. It could be Zumba, it could be aerobics, it could be dancing to Bollywood tunes with your partner, or walk or catch a game of shuttle with your little one, go swimming. So do something which makes you physically active, because physical activity is the cheapest way of getting yourself into a good form, doing stress busting, increasing your flexibility and everything. So there's a message there to all of you to be physically active. Thank you. Now we'll go to a next question that is actually very interesting. I'll give you a little background. So nowadays, increasingly, that too in the West, this concept has come that we are taking hold of everything and medicalizing it unnecessarily. So we are medicalizing pregnancy, we are medicalizing childbirth, doing unnecessary sections. And so in UK, a movement came that everyone wanted to go and deliver at home. So because they thought we are doing unnecessary incisions, sections. So this movement came that there were some nurses and midwives who wanted to go back to previous kind of care, where a lady and her grandmother were in charge of their fertility, health or conception and delivery. So here I want to have a question and I want your take on that. Do you think fertility, pregnancy and all have been made unnatural and we are making a hype of this kind of care? Or do you think it's really justified that we take it up as a cause and say, here, please take care of your fertility, please take care of your pregnancy. There are certain scientific advances that have come, and there is a reason that we are asking you to medicalize your pregnancy and your fertility and your health in general. Don't take it for granted. That's what we are trying to give out. Astha, your take on that?
So I think people, when they say that it is little hyped and nowadays people are pushing that, but we have to see to the causes which is happening.
Absolutely.
Because nowadays, earlier when my mom got married, she was in her 19 or 20 years she got married. By the time I had my first child, all three sisters were born. So that had a different kind of an approach. But nowadays we have to study, we have to get our jobs, we have to find a good husband, because then your expectation is also there, right? So those things takes a lot of time, and then again your lifestyle, your pollution, everything is there. So I don't think so it is not at all hyped, because we have to see from where we are coming from. The whole those 10 years of life we are using to build our own career, ourself, our personality, or our self, to prove ourselves to ourselves or to the others, whatever might be. But I don't think so it is hyped. But the thing is, we have to be aware that where we need to go and how we need to take it forward.
Very well said. Thank you.
Yeah.
Gauthami?
No, I think absolutely in agreement with what Astha is saying, right? And I think my first ever counseling session with ma'am said one thing. It's, if you plan earlier and if you can do it sooner, the amount of medical intervention that you will require and support you will require will be lesser. So it is about, and I was trying to take her counseling on when to plan, and because I had certain milestones and hence I wanted to plan a little later. And Preethi ma'am will say, don't make it an unnatural process, but because I had certain needs, just like how Astha said, I had certain milestones, I had certain timelines, but ma'am was clear about that. Gauthami, it's absolutely your choice, but know that the amount of medical support and intervention that you might need will change with that timeline that you're planning. So it's as simple as that, right? If you've conceived with like 0 interventions, congratulations, that's great. But if there is a certain lifestyle or there's certain, biological reason because of which you need the medical intervention, please don't delay and rather like go seek advice as early as possible, right? Yeah, that's
I think
all
there's
would
not so much of medicalization, but I think it's because of the lifestyle choices.
choices.
We are making, it's bound to, go in that direction. Correct. So as long as you're aware and you're able to make a right balance and make a right choice, I think that's quite a fair thing to look at.
And actually on that note, I mean, while let's say they advised that way, and when I went through my pregnancy and towards the end there was the whole question about C-section or natural or whatever, my obstetrician pushed all the way through till the end to have a natural birth, right? So it's only it's I think very good judicious call being made on when you need that intervention and when you don't need that intervention. Right?
Anupama garu,
Yes.
your take on this?
I think at an individual level, it has a lot to do with awareness. A lot of the time, including myself, the girls these days, we are studying about everything in the world, but not about us, our bodies, and what's happening, what's right for us. A lot of the time, it boils down to what do I really need at this point in time. So if I am physically fit right from the beginning, and if my body supports me throughout the process, I think what is right for me is going to be natural. But if I am somebody who has had lifestyle issues, or if I really need certain medical intervention, calling it as a hype will not help serve the purpose. So at an individual level, it is to do with a lot of awareness about me, myself in the first place, which I think is lacking today. While the focus is a lot external, the internal focus is something that it will be good if we can have means of building. At a macro level, on a decision-making level, I think the right means to proper outcomes medically, legally is everybody's right. So denying that in the name of a lot of hype and certain examples is, I don't think, the right example we should be setting. Because there are a lot of stories that we have heard in instances, in years, in legacy, that people have suffered because of the lack of this kind of technology, this kind of medical advancements. So those are instances for us to believe in the system and say, yes, this is for my help, but do I need it? Am I the right person for this? Do I have the right expert to guide me on this? That matters a lot at the end of the day.
Dr. Pallavi?
So I think there are two eras. The social media era is now which we are living, and prior social media era, nobody knows what is happening in the world. It might be so many abortions, or mothers would have died because of bleeding, or not taking decisions at the right time, trying for natural pregnancies or natural deliveries, whatever it might be. But now we are in an era wherein even a small delivery of 3.5 kilo baby somewhere inside China also will be knowing right in our hand. So I think that is the whole globalization which is happening. Now we are knowing everything. Yeah. Probably this is, I feel it's all artificial hype which is said that medically we are too much of interfering into the system. But I think when we compare the complications and medical interventions, it's always better to have a medical intervention than to have a complication, which we have never seen prior. Now probably we are rectifying things and we are going into a better evolution. That's it.
So to summarize, I just want to say, when we sit in a clinic, we get two vastly different kinds of patients. One couple will be only in their 26 or 27 and she'll say, Doctor, my sister-in-law conceived and she's 24. I have to conceive this month. Please do an IVF for me. And the other end, we have a 32-year-old or a 35-year-old who says, Doctor, I've taken good care of myself. I still want to try for another 2-3 years naturally. Please don't start me on medicines. So what I want to say is there has to be a balance between no treatment and treatment. So when young couples or slightly older couples, I just tell them this, come and have all the assessments. Let's have a talk and see where our chances are realistically, and then we can go either with treatment or just naturally we can wait for another couple of years or a couple of months. So take everything with a pinch of salt. Don't believe what all you read out there. Go. And one more thing is, each couple is unique. What worked for the person, your sister-in-law, is not going to work for you. What worked for your friend, as she said, in US or China, is not going to work for you. So as a couple, you go meet your doctor, have an individual assessment, and then there will be a conclusion as to what works for you and what is really hype. So there is this most common thing that says, My mother-in-law said, don't go to the doctor. She'll say, do IVF for you. So don't see the fertility specialist. So we are there for a reason. We are there at every corner for a reason. So if fertility, at the most, what I can say is get a second opinion from another reputed doctor if you were advised something, and don't dismiss anything just for the face of it.
Yeah, I think as a role as a specialist, when we have a situation like this, it's important for us to give the right information. And and let the couple make an informed decision. See, despite understanding what this process involves, IVF and all, and still they wish to go ahead, and that is what they've decided to go ahead, that's kind of an accepted treatment line for them.
Yeah. So my next question comes from a real interaction I had with a highly educated lady. So she was also an IIM faculty. And they came to me at 38, 39 years of age, and there was really nothing much I could do. This was more than 10 years ago. So at the end of the consultation, I just said, you had married at the age of 30, but 8 years you were planning your life. So what was the reason that it had taken this long to come to me or come to a fertility doctor? She said one thing that really stuck in my mind from that day to this day. He said, doctor, I heard that Madonna had a child at 42 and I thought I could also wait. So from this, I really thought that we should be giving the message of biological clock to all the girls, even however old or young they are. And your take on it, Astha, what was your perception of biological clock? I mean, were you aware of it? Were you actually thinking of it? Or did it not come into your perspective?
It was always there in my mind because my mother was always behind me and she was telling me all these things, and it was there in my mind, but the thing is like how everybody thinks that this is not the right time. I mean, we are very young, we can push it little forward, so that's the same thing happened to me also. Though I was aware, but still I took pregnancy at backseat and I was like, okay, we can plan little later. But yes, I mean, the biological clock is always being there, and the struggles which I had in my life, I didn't let it happen with both of my sisters, and they had a natural conception and they are really now have healthy babies. So definitely the biological clock plays a role, not even for women, it is also for men. We think that only women are impacted, but I have seen really very close few of my friends that men are also getting impacted because everybody has this stressful life. So we have to definitely understand that and work on it as soon as possible. Thank you. Gauthami?
No, I think it is for real. If you didn't believe when your mom was saying it, please believe when your friend is saying it at least. So when I was going through the journey, I at least called 5 to 7 of my friends and said, dude, this is real. You please pay attention to it from now on, right? And at least be aware of, okay, what it impacts, right? And it's your choice. I mean, after that, it's your choice if you want to be more prepared about how you can plan for a pregnancy later on. And I think we only know Madonna had at 42, but we don't know what all she did in order to have a kid at 42. I feel like the whole awareness around, I mean, if that is your choice, the awareness around what can you do to make sure that you still have your option and your choice to have a baby way late after your biological clock, I think that awareness is very, very low. Like I did not have that awareness. I definitely approached a little late than I could have. And even then I approached only because, let's say, a friend who went through the same kind of came and expressed. So we are naturally used to rebelling against our parents. I know we generally question them on a lot of things, but this is not one thing to question them on. When they're saying, hey, please have kids at the right time, I think it is true. But even beyond that, if you have a very strong reason as to why you want to have a kid sometime else or a little later than what is recommended, then please meet and consult and take medical advice to what kind of support it requires, right? It is not like we are going to aging, we can all see aging on our face, like similarly there is aging happening inside also, right? It's as simple as that is what I understood. But yeah, I think we tend to not take that advice when it comes from parents, so please hear it from your own
To add
peers.
on to her point, I think biological clock is one thing, and the other thing, when we feel that this is not the time, we are very young to have a child and later we can have, but from a career perspective also we should think that if we have a child very late, then like in your 38 or 40s, you're now a VP, AVP somewhere, then you have lot of responsibilities. Then how this will match? Because you have to do your career well. I mean, you have to excel because they are paying, so you have to perform as per their expectation. And you have a very small child. How we'll manage this? So having an early child will give you that balance in your career also and with your personal life. So that's what is my
very
take.
well said. Very well said. I think
so if we delay that, it will impact your career also, which we think at our early 30s, okay, now we are, once we become this, then we'll have a child. So that will impact later.
When you're at the peak of your career, you have so much of responsibility at home, and it's highly impossible to strike a balance. So rather finish off your family while you're very early in your career, and then you have all your time for your career later.
And we'll have strength to play with our kids also. That's also another thing.
You wish to add anything?
Yes, I would like to add from a corporate perspective. See, when you are fresh entering into your first job, I think in your early 20s, you are very much ambitious and you're trying to make your life. You're trying to make your personal life with your spouse, you're trying to make your professional life at your corporate, you're trying to build your dreams, you're trying to prove yourself. And I think it is more of us not being aware of our biological clock and not being aware of what's the right thing to do and how do we plan, both in terms of role models. We have hardly very few women up there who have done that, whom we can see and emulate. At least in many of the career spaces, we don't have that. I remember when I delivered my baby, I got back to work in my second month after I delivered the baby. And my friend, she happens to be my manager also, she called me one day in the morning around 6 o'clock. That's when I was supposed to prepare for the day's work. She called me and said, Anupama, we need this report. And I was like, my son is not well. He's just 2 months old. I think today I will not be able to work. I'll not be able to do anything. And she just said one thing. See, if you look at things when they matter the most, all you will be doing is fighting your crises. If you are aware of your life as a whole, then you will have an awareness of things, of what to plan and when do you plan for it. And that set off a lot of thinking in my mind, and that's the perspective I really recommend girls of today need, because in every sphere, girls today are making very informed decisions. They're very intelligent, very smart, but the informed decision making with respect to our own bodies, biological clocks, our own selves is the only missing piece in this puzzle. Because when we realize, I think it is either too late or we have not timed it well. Because you want to prove yourself or you time it too early because you have not proved yourself. 2 years into your first job, you have taken your maternity break. 2 years break, coming back is a big Herculean task. But if you have had 4 years into your first job, that's 26, 27, you have proven yourself, you have got accolades, you have got history to say that you are what you're worth. And then you take a break, you come back, because at that point your energy is in the right space. You have built your community at your workplace, you have built your community at home, and you know how to leverage both of them to your advantage. And then you come back, you can come back early, not 2 years. You can come back in the first 6 months and start making a difference and leverage those strengths to your advantage. I think this awareness, if we can have at multiple levels, is very liberating, and that will help us make the right decisions in the right biological clock space.
Yeah, I feel biological clock, I mean when biological aging of the ovaries, it doesn't have to always go with chronological age. It doesn't mean that a 35-year-old will have less number of eggs compared to a 25-year-old. So there is this aspect of aging with, age, and also a biological clock which is very different for every woman. We tend to see even a 25-year-old woman having less number of eggs. So we cannot see, it's important for everybody to get their biological clock assessed before they make these decisions of, postponing their pregnancy or, postponing their family. Yeah. So any couple who is married, I think they need to have a fertility consultation to understand what their biological clock is. So then accordingly the right decisions can be made.
And to add on to Madam's thing, I think now girls are just blessed in this era. They have super cool dads who just want to see their girls taking the rocket away to the space, and even the husbands are too good to support them. But I think career, when people are too much into career oriented, we see late marriages above 30 or something like that. Not only the married couples, if your career is taking too much of time, I think even the unmarried girl can come to a fertility specialist to just check their biological clock. And there's something called social freezing of oocytes, wherein they can opt for that and they can freeze their oocytes if the oocyte count or the egg count is less and they want to, still pursue their career and still take time to get married. You can still have an option of social freezing, and then you can do whatever you want later, and you can have a blessed baby also.
That's what Madonna would have done. Please know that.
Yeah.
But see, one thing we have to understand, our aging process is very different from them. Yeah. Our ethnicity is different. We age faster than them. So absolutely no comparisons with any other person, because our own clock, we are, we have a set clock for ourselves. So assessing individual clock is very important.
Agree. Yeah. So to summarize all this, message to the young girls over there: if you lose a few strands of hair, or if you have a pimple on your face, I'm sure you're going to run to the dermatologist and say, "Doctor, I'm having hair fall. Doctor, I'm getting pigmentation. I've got a pimple." So similarly, as one of our panelists said about internal aging, you have what are important things called ovaries. So you may not see them every day, but please make sure that you get them checked once in a while and have a gynec checkup and see what your fertility and what your eggs are doing. And also, instead of relating to Madonna and Trump, who had a son at 62, try to relate to your Indian idols and have your culture with you. Thank you there. Now, all of us have mentioned about social media here and there. So I just wanted this point of view from all of you. Are we relying too much on social media for information and advice? And are we moving away from our traditional mothers and grandmothers' advice, which, came down from generations and generations? And your take on it, Astha, you've already touched upon it. Thank you.
I think yes, people are doing all kind of Google, YouTube, Insta, everybody is doing that. But having said that, it gives you an insight, but it is not the go-to thing, because everybody is different, every experience is different, and those could be a generic kind of data available, and they may not be correct. So you have to, your go-to person should be your gynec and nobody else. You can take advices, you can learn from the experience of people, but the final call has to be taken from your gynec. It cannot be a social media, no Google, nothing.
Okay, thank you.
Yeah. No, I think any kind of Googling or social media will be driven by your own bias. So if you look for, can I have a kid at 35, you'll find articles on how you can have a kid at 35. So it is important to know what, definitely rely on, friends and family around you. Also, like, somehow we'll end up, thinking that when you read about someone or whatever, you'll think, oh, this is not me. But only when you see a friend in your real life, or maybe a family member telling, no, you need this, is when you will actually take action, right? So for me, it was important for that to come from a friend. Otherwise, I was one of them who was Googling to figure out, yes, you can still be okay and you can wait. But I don't think it's a reliable source at all. It's completely driven by your own bias of what you want to see. Correct. Yeah. Right? So
I think more than Google as a source, within the internet, we have to also look at the source. Because at the end of the day, social media is one thing, but the internet as a whole is very informative. But that said, the main question, if we are moving away from our traditional knowledge, I think that is true. And that is unfortunate. And it is high time that we go back to our old mothers, grandmothers, and look at the knowledge that they have and have these conversations with them.
Absolutely.
I think the root cause is we have stopped having these conversations within family, within the elders to a lot of extent, because of, we blame it on the rush hour, blame it on the work schedules. But these are very critical things that we should be doing at home. And the traditional medicine, the traditional practices have long been lost. If we have had that, I don't think even for ourselves or our kids, we would be just running to OTs, over-the-counter medicines, for everything, every small thing.
Sure.
And that said, I think the first person to always reach is an experienced expert and somebody whose guidance really helps us. But basing what is generic will not really apply to one individual. That is definitely a no-no.
Yeah, and absolutely rightly said, because when we as a professional, when we do these information talks, it's a very generalized kind of a talk which we give, but it may not apply to each and every patient. So don't take that information is just to have a basic knowledge. But in depth, when you want to get yourself assessed and to know what it means to you, I think you need to visit a gynec. And going back to this traditional advice from grandparents, usually we tend to brush it off saying they're old-fashioned, conservative and all of that. But there is some amount of facts in them.
Yes.
But also you need to have a balance. If you go and ask your grandmom and tell them that I'm going to have an IVF, and she's like, no IVF. So even I think, you need to have a balance.
Yes, absolutely.
Because IVF, the fertility treatments are safe. But that generation, they don't believe in fertility treatment. So I think it's important for us to take the right kind of information.
I'm sorry, I would say a relatable friend, someone who is in the same age group has gone through, and I've seen the moment I kind of exposed myself to what's the medical care that you can have. I think at least there were a couple of friends that came and visited ma'am because they were more comfortable to know, it's okay to meet a fertility care person and talk about what should I take care of, and you're not planning even today, it's okay. Right? I think one of my friend who just got married and then she came 2 months after marriage, she just came and visited mom because she had a certain idea about when she wanted to conceive, etc. So it's important to take that peer advice maybe. We are more amenable to believe a peer or a friend than believing previous generation. And like ma'am said, our previous generation never had the concept of fertility care and fertility doctor and all is still alien to them. So our lifestyle has changed a lot from the previous generation.
And we should be fortunate to be living in a country like this where medical care is so very accessible.
As well as we have social and family support. Pallavi, your take on social media?
I just want to add one line. It might be a little harsh, but I just want to say that Google is never written by a doctor. So it's always better to reach a doctor to have a better advice than to sit in front of a system and look for your advices.
So I'd like to summarize saying social media, Google, internet are here to stay in our lives and our lives of children. They should be used with rationale. Whatever is put on the internet is not validated by a professional source. So take it with a pinch of salt and recheck whatever you have read. Being informed is good, all right, but being misinformed is really bad. And the other thing about social media is, one of our panelists mentioned that we are forgetting to live in the moment. If you have a plate of a nice masala dosa, you want to first put a picture of it on the Insta and then only you want to eat it. And if your kid is starting to walk, you first want to record that and then upload it rather than enjoy the moment and see whether he is going to fall or not. So guys, come on, we know social media, Insta and all are ruling the roost, ruling everyone. But please rationalize it. Live your life. You are not living online. You have a life of your own. So enjoy your hot dosa and then try to put it up on the Insta or whatever. Please use social media with balance. That's what I want to say. And then, I'm coming to one tricky question. Did you get the right support from your spouse when you were this thing, or do you want to give any tips as to how to approach your spouse for support and help in this juncture of planning and parenthood?
I got a lot of support from my spouse. He was really helpful throughout the whole journey, from the idea of starting planning, which started way back in 2015. And I had a baby in 2019. So those 4-5 years, he supported really well. And I would also like to thank one of my really good friend. I was struggling and she was like, okay, I went to this doctor. Why don't you go to this doctor? Instead of just saying that you can't get it. Let her decide that this can't happen. Why are you deciding? And I got support from my friend, and my spouse really helped me the whole journey. And the other thing is that since he is not into this whole physical changes which is going on through, I think that being little open about what you're feeling, your emotions and everything, if we keep sharing with the other person, that really helps them to understand, because they are not feeling that pain, right? They are just seeing as a second person from outside. So if we speak and if we share every single thought about the pain, about physical, mental, everything, that also helps us to connect and get the kind of support which we want.
Excellent. You're blessed in that aspect.
Yes.
Gauthami?
No, I think my husband is not on social media, so I can say whatever freely I want to say. But no, I think I just want to touch on one thing that Astha said. I think everyone will be supportive if you can help them understand what you're going through.
Right.
I think that's the, it's very difficult to know what is it that is troubling you, what are you going through. If you just, I mean, we are sitting on our own and just going through that and not articulating that to your partner, they will not be able to do anything. So it's been very, very supportive that way. I think the few troubles, frankly, I think it was a smooth journey for me.
Right.
Like, that's how I would want to see it. I mean, at least after I've gone through it and come out of it, I don't think there were major hurdles or anything for us to cross. It took 2.5 years to go through that. It was a smooth journey, and he was definitely understanding. Whatever, it was more during the pregnancy, I think, where the support was required. The stress of conceiving was not, you know, like me and ma'am spoke, we found our ways to like just get busy with work and forget that. So that was not a phase where I needed a lot of support. I was okay with that. But during pregnancy, I think whatever physical trouble that I had, etc., if I could articulate, he was always there to help. One small example of what I want to say, why it is important to help them understand is, I don't know if everyone will understand this and how to articulate this. But during my delivery, it was a natural delivery which took almost like 15 hours or so, right? 15 to 16 hours. And what do you call that, ma'am? The one that tells the contractions intensity?
CTG. CTG.
Right? So there's a machine that basically tells what's the contractions intensity. And my husband could see that, okay, my emotion of emoting pain is very equivalent to what he could see on the machine. And he could understand the whole of the 16 hours of pain primarily through that. And he came out and he said, like, when, you know, parents or whoever was asking, hey, what would you name the kid? The first thing he said is, she's gone through so much. She's the one who gets the choice on what should you name the kid, right? He was able to, because he lived through that 16 hours of seeing that and, you know, knowing that, oh, her pain is at this level is something. I think that number on the machine, you have to do more to say that to your partner.
You have to allow them to see your pain and
So whenever there's a contraction, the heartbeat goes up. So
Right?
And I guess we are really blessed at this age that men are also allowed to watch all these things, so they understand the pain and the whole journey. They understand.
So you won't have that machine all throughout. So hence you need to do your job also of communicating that, hey, this is what I'm going through, right? So.
I'm sure he is very proud, even if he's not on social media. He'll be hearing this. I think my husband and I have been lucky. We are partners in crime. So it was completely a single journey because we didn't spare anything discussing right from midnight ice creams to everything. So it was completely a single journey that we both went through. But I have also seen some of my colleagues who do not have a supportive partner. And I must say, somehow in this system of marriage, we have certain expectations from the spouse. And when that is a lacuna, it hits very badly. And this generation, I think we can always communicate, and communication is the key. We are very lucky to have people who are understanding, who are forthcoming, who are part of the journey. But in case somebody is not, communication has always helped majority of the times, which I have seen myself. And talking to them, involving them in the journey right from the beginning, although they may not really empathize because they may have a completely different perception of this journey, and take it as something that is natural that women only do, or they have a no clue, different spectrum ends. Involving them, communicating them, telling them, keeps them engaged irrespective of how the outcome is temporarily. and that has paid off to some of my friends. And in my case, I have this kind of a husband who faints when things like this happen. So I consciously kept him out of certain things, certain journey aspects, but yes, it is very important.
So to sum up, yes, spouse and spousal support are very integral and important for us. If we are lucky and blessed to have understanding and caregiving spouses, great. But suppose they are on a different location, or the poor chap is working all night to take US calls, I suppose you can substitute him from your brother, mother, sister, or his sister or somebody, and you do need support. So take it from some place and just make it work for you.
With your permission, I just want to add something. After my delivery, there was this lactation consultant, a very old ma'am, who just told me one statement. She was helping with me, helping the pillow support and everything, and she said, Anupama, you need to learn to manage everything on your own because it helps you in two things. One, you don't think others are neglecting you. So there is a misconception that we get because we are in pain, we are in need, and we tend to see it as others' neglect towards us, which may not be the reality. So throughout the journey, not just after delivery, I think it is very important to be self-sufficient, communicate these needs, and also not see this as a lack of neglect or a incompetence from the other side and lack of support system. That hits very hard otherwise.
Very true. Actually, just one thing I want to add to what you said, Mom. Please don't burden the spouse also with everything. Like you need more than
he's working to pay the bills as well.
Emotional state that you are in, it's not easy for just one person to absorb all of that.
The things.
Right? So spread it out to friends,
system, have a broad support system.
A little more.
There was this other important question, I think, which Astha addressed. How do you get your superiors to support you? I think being communicative, talking to them, and making them aware of the troubles you're going through, and being open about the whole thing. Nothing being ashamed in getting a little period pain or wanting to take time off for heavy treatments. Just be open. And finally, we are running short of time. I want each of the distinguished speakers to just give a message to the young ladies over there. They have had lucky journeys as empowered women, taken the right steps. So I just want them, each of you, to give a two-line message to the girls out there who are trying to plan families and get it all right as the speakers have got it.
So my takeaway on this would be 2-3 things: that be self-aware about yourself, about your body. Take support from your gynac, from your doctors, from your family members as and when required, and see to it that your career is also important, but at the same time you have to prioritize what you need at that particular point of time, because if not now, then never. That's the only thing. Thank you.
Thank you, Astha.
One is, I think, whether you're planning, not planning, whatever phase you are in, please meet a doctor. Just discuss. I mean, this is still this is discussed at a very high level. So each individual's scenario will be very different, and hence everyone needs to have a one-on-one dialogue with a doctor, right? That is one thing that I definitely want everyone to take away. And second is try and keep stress at bay as much as possible. I don't think all said and done, this is a process to be enjoyed. This is a process to be cherished and remembered for life. So don't let stress be one of the memory in that, right? So figure ways to keep stress out of it. These are the only two things.
What I would feel is the journey starts very young. We see teenagers with PCOD and PCOS these days. So the journey and the awareness of I am here to do bigger things, this is not a sprint, it's a marathon, is very, very important. So if we start early, the benefits are much longer and much deeper. The second thing I would say is, on a work front, it is not that the day you perform your worth and the day you don't perform you are worthless. Sometimes we associate our worth with our day-to-day performance too much and take it to our insecurities and everything. It is very important to have that self-security and that belief in yourself that this is what I want to do, and this is what I'm cut out for, and seek that clarity. Today we have a lot of mentors, we have a lot of coaches, we have doctors who are reaching out, who are doing a lot of awareness talks, who are available. It's not a taboo to just walk into a clinic and say, what is the advice I want to plan my further life? And that is possible, and that's the vision that people are giving today. And that's the counseling that we need to make informed decisions right from a very early stage.
Thank you.
The conception and career, every woman should prioritize and take a balanced decision so that you don't regret later. Whatever decision you make is right. So you don't have to, go into social pressures or other pressures. So whatever informed decision you make is absolutely right and justified.
So probably doctor is not a person who just sits and write a prescription for you. You can still have a nice talk with the doctor and have a good counseling and go back with a lighter mood. So you can always walk in whenever you have any problems. And I just wanted to touch upon the biological clock. Please don't neglect your biological clock.
Yeah. Thank you. You've been wonderful panelists. We're just waiting if there are any questions from the audience, online or physical. So we are trying to go green, giving you a small plant sapling. Yeah. Thank you very much.
Thank
you. For your time. Shravya to ask Gauthami madam and Astha madam. Thank you so much. Thank you. To Astha madam. Thank you.
Thank you so much. Thank you.